Good afternoon. My name is Leslie Fleming, and this is my benchmark assessment for a functional communication plan. Thalia is an 8-year-old girl and was diagnosed with autism spectrum disorder when she was 3 years old. She is a nonverbal student and uses visuals to communicate her wants and her needs. She is currently receiving services for speech and occupational therapy. The stakeholders that are currently involved with Thalia are her parents, her special education teacher, her speech language pathologist, and her occupational therapist. Thalia demonstrates communication needs due to being nonverbal. She shows deficits in nonverbal communicative behaviors used for social interaction that range from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language. She does also demonstrate weaknesses in understanding the use of gestures. Thalia lacks facial expressions along with her nonverbal communication. Body language and facial expressions are a part of communication. Therefore, since Thalia lacks these types of communications, it is difficult for others to understand what she is trying to say. All of the stakeholders that work with Thalia should develop a plan for her verbal and nonverbal communication and instructional behavior to meet her needs. We want to ensure that ethical practice and ADA compliances are being met and implemented appropriately so that Thalia is able to reach her goals and effectively communicate. Since Thalia is 8 years old, social stories are a great way to show children how to appropriately communicate with their peers and adults. By implementing social stories, this will engage Thalia and show her how to communicate. I would also include a peer to share the social story with Thalia so that we could also practice modeling with another student and the teacher. I would also send home social stories for different settings and experiences that Thalia might have outside of the school environment. This would give her parents an opportunity to help her if they were to go to a restaurant or a park, shopping, etc. Thalia's speech language pathologist could also help with creating specific social stories to review in her sessions that would address different experiences she might have in the school environment. I would also ask for assistance from her speech language pathologist to help with her communication through different visuals that could be created. Because Thalia has weaknesses in facial expressions and body language, her occupational therapist could implement different exercises that would help her in communicating how she feels and how to engage with others using facial expressions and gestures. Visual cues in social stories and body language and facial gestures are important for Thalia to be able to use in a structured and unstructured setting. Social stories are examples that Thalia could look back on to help her in different settings and how to appropriately communicate. Visual cards for emotions can assist Thalia in communicating how she is feeling, whether it is happy, confused, sad, and other emotions. Visual cards are going to be an imperative AAC support for Thalia because of the lack of body language, facial expressions, and being nonverbal. Eventually, I would like to see Thalia with a communication device. Once she has mastered visual cards, then the communication device would be an easy and efficient way that she could communicate her wants and needs quicker. By working on these strategies at school, at home, and in her therapy sessions, Thalia could catch on rather quickly to help her progress towards meeting her goals in communication. All stakeholders involved with Thalia's communication plan can model the expectations, respect, and ethical practices by first having patience with Thalia, as this plan is new to her and she is learning how to appropriately use the different strategies involved. To show Thalia expectations, all stakeholders should model how to effectively use the strategies and to do so respectfully when communicating. As this new plan will take some time to show progress for Thalia, it is important that stakeholders stay in communication to give updated data on the strategies and to also discuss if any adjustments or modifications should be made to help Thalia accomplish her communication goals. Thank you and have a great day.